This is a group presentation, and it's also going to include Kelly Davis and Samantha Zimmer. Our project today is on impaired employees. For our project, we chose a hypothetical. For our situation, our nurse Amy is the nurse on the post-op orthopedic unit, obviously a unit that dispenses a lot of post-op pain medications and narcotics. Her coworkers lately have noticed that she's been coming in a little bit late to work, looking disheveled at times, and also being unreachable off the unit. There's some concern that our nurse Amy might be coming to work impaired. So some of the statistics, according to the American Nurses Association, approximately 10% of the nursing workforce is affected by drug or alcohol dependence. That might not seem like a lot, but that's actually approximately 1 in 7 nurses that are currently affected. So some of the effects on healthcare, obviously, that's risk to the patient. If you're impaired, you're not getting adequate care. If there's any sort of drug diversion, that would be the patients aren't getting their pain medication as prescribed. And obviously it's going to open up liability for the facility, for lawsuit, and just for not receiving proper care. So those are some of the issues involved with an impaired employee. So the next topic is going to be leadership styles for dealing with an impaired employee, and that is going to be discussed by Kelly Davis.
In the instance of an impaired employee, the best leadership method is the authoritative method. This protects the patients, the staff, and the hospital from any liability or injury or safety issues. Some characteristics of authoritative leadership is strong control, high productivity, and direct decision-making abilities. Some pros of authoritative method is rapid decision-making and effective policies and procedures that are put into place to protect the facilities.
Hi, my name is Samantha Zimmer, and I will be discussing the disadvantages of authoritarian leadership and also our conclusion. So one of the main disadvantages of authoritarian leadership is that it hinders the trust and the communication among team members that are working together. This, as a result, is not a preferred method of leadership among many healthcare professionals. There are time and place for authoritarian leadership to be used. However, it's generally not what is preferred by those who are working underneath a manager. So, in conclusion, like I said previously, authoritarian leadership is not the preferred method of leadership in a healthcare setting. A democratic environment is generally preferred and can produce more teamwork among members on a healthcare unit just because of the nature of the leadership style. Authoritarian leadership is an appropriate approach for extreme situations, such as the nurse that is impaired on a unit. This is because this nurse could potentially be a harm to the patient and also to herself, and as a result, this should be dealt with in the appropriate manner. A manager that would approach this type of a situation with a democratic approach would probably not be using the appropriate method because it's not meeting the type of situation with the type of leadership that should be used. So in our situation that we described earlier, Amy is interviewed by her nurse manager after she's reported by a peer for potentially being impaired. After the interview, the manager determines that Amy most likely is impaired. She sends her for a drug test, and she educates her about what her options are going to be and what the punishment will be as far as seeking treatment and if she doesn't comply with those types of situations. In most states, there is a program in place to help nurses that are impaired and that have been found to be diverting medications, and Florida is one of those states that has such a program. And then we have our list of references. So thank you so much for listening to our presentation. This was Jennifer Carle, Kelly Davis, and myself, Samantha Zimmer. Thank you.